With the Medicare Annual Enrollment Period nearly underway, it's an important time of year for millions of older Americans. Joining us now to discuss is the Vice President of Medicare Advantage at United Healthcare, Betsy Chin. So, Betsy, why is the annual enrollment period such an important time for older adults?
Well, David, this time of year, the annual enrollment period, which starts on October 15th and runs through December 7th, is an important time of year for anybody on Medicare because it's for most people the one time they have each year to make a change to their coverage.
So what are the most important things to consider when enrolling in a plan?
Some of the most important things to consider are cost. How much do you expect to pay for your coverage next year, as well as the costs that might become associated with co-pays or for drugs or for clinic and hospital visits, as well as the doctors that you want to see, making sure that they're in network for the plan that you choose. And same for your drugs. Make sure that the prescription drugs that you need are on the approved drug list for the plan. And then finally, take a look at any extras that you might be interested in. Things like a free fitness membership or dental, vision, and hearing coverage, which now come on many plans, including many Medicare Advantage plans. Those things are all important to consider when you're making your Medicare coverage choice for next year.
So as we get older, a lot of us have to take a lot of medications, right? So what should people do to make sure that their medications are covered?
That's right, David. It's one of the most important things for people to look at. We suggest starting with the formulary or the approved drug list for each plan. The approved drug list will tell you which drugs are covered, and you'll need to take a look at what tier of the drug list that they're on. The drug lists are typically broken into tiers 1, 2, 3, maybe 4, and each of those have a different cost associated with them. So you want to take a look at the drugs that you know you'll need to take next year. First, make sure that they're covered. And second, find out what tier are they on so you know what the cost share will be for you next year.
Gotcha. So there are several different types of Medicare. Can you discuss the different types that exist?
Absolutely. There's a lot of options out there, which is why it's so important to get educated during this time of year. First, there's Original Medicare, which comes directly from the federal government, and that includes Medicare A, which is hospital coverage, and Medicare Part B, which is outpatient coverage, things like routine doctor's appointments. Then there's Medicare Advantage, which is called Medicare Part C, and that combines Medicare A and B into a single plan offered by a private insurance company like United Healthcare, and it often includes Part D as well. Part D is the prescription drug coverage. These plans often also include some of the extras that I mentioned earlier, things like fitness memberships, dental, vision, hearing coverage. And then there's also Medicare supplement plans. Medicare supplement plans work alongside Original Medicare and are often combined with Medicare Part D plans so that you get drug coverage as well. So there's a lot of options out there, like you mentioned, David, and it's really important for people to use the time in the fall, this Medicare annual enrollment period, to make sure that their coverage meets their needs.
That is very useful information. There is quite a bit to unpack there. So if folks want to learn more, where can they go to find more information?
I'd suggest starting with MedicareEducation.com. It's a great educational resource, and it can also help you find local resources in your area to get even further information about the plans available near you.
Excellent. Betsy, thank you so very much for joining us today. And guys, you know, you can always catch this information again on our website,